Coming up this Saturday, the 29th of the month, they've got something very important over at Arrington Cancer Center. Joe Velasquez is here, and Laura Mack's going to get to the bottom of this.
Oh, that's so bad. And that's Leslie Cranford. You hear laughing.
Hey, now listen.
Don't encourage
Joe,
him, Leslie.
Joe,
Yes,
Joe.
yes.
Did I say anything that was insincere or insensitive?
Oh, my word.
No.
Of course not.
All right.
Of course not.
Prostate cancer. It's a big deal for men. Isn't it like the second leading cause of cancer death?
It is. Prostate cancer, there's not a lot of awareness of it. And so we're going to have an event this weekend because men don't tend to know too much about prostate cancer. So we're going to have an event on Saturday. Prostate cancer is actually the second leading cause of death in men behind lung cancer. And a lot of people don't know that. Mm-hmm. So, yeah, it's good to get the word out and bring that awareness to everyone. And so we're going to do an event this weekend and hopefully get some men out to get checked.
Now, a lot of people think, oh, I don't want to go get tested because I don't want bad news. I don't want to find out. But really, your survival rate depends on finding out early, doesn't it?
Well, it does. Prostate cancer is a very slow-growing cancer, which is a good thing. So really, to be tested, you should be tested at an older age. One of those tests that they do is what they call a PSA test, prostate screening antigen. And so what that does is just an indicator that if it's high, it might indicate the possibility of prostate cancer. But it's one of those things that you have to do, and you have to have a discussion with your doctor or a doctor. It's not something that you look at and panic and go, oh my gosh, what am I, I've got prostate cancer. You have to have discussions with the doctor and make sure that you decide what's the appropriate thing to do.
Right. Now, what is involved with the testing that you have going on Saturday?
It's very easy. Most men are familiar with two types of tests. One is they just take some blood from your arm, a little blood test. The other one is the one that men really don't like. We're not doing that one. So come Saturday from 8 to 12 o'clock, we're going to have a screening. They'll take your blood. We're going to have some educational information to hand out. And we're even going to have some breakfast because, guys, we like breakfast. Mm-hmm. So we're not going to have muffins, and we're not going to have, fruit. We're going to have actual either breakfast burritos or breakfast sandwiches. So we want men to come out really age 50 or above. Because it's so slow growing, you really, a lot of it can't be found real early. So the American Cancer Society suggests that you have conversations with your doctor starting at about age 50. So we're asking men, if you haven't had one, come on out. Or if it's been a while, or if you had one and it was a little elevated, come on out, have another one. And it's something that you might want to follow, but there's a few things that you can do. It doesn't necessarily mean that you got to run out and go have treatment and things like that. So that's why we really emphasize talking to your doctor about it.
How often should men be checked for prostate cancer?
Well,
is this like a yearly thing they need to do, or
I think if you find something, let's say your indicators are high, maybe every couple of years, but your doctor will direct you on what to do with that. Age 50 at the minimum, unless you have let's say a brother or a father that's had prostate cancer, then have those conversations about 45. Or if you're African American, I would have those conversations a little bit earlier. But aside from that, usually prostate cancer doesn't develop until probably a little bit later age, even up into mid-50s, up to 60. Mm-hmm. So it's not something that you need to panic about. Even one of the things that you might do is what they call watchful waiting. Sometimes it's so slow growing that you may not need to do anything. You just periodically check and make sure it doesn't, move up rapidly. So, we want to make sure that there's an awareness about prostate cancer because men don't tend to focus too much on that. And September will be Prostate Awareness Month. So that's why we're doing it on the 29th of August, right before September, to bring that awareness to men.
Yeah. And it's absolutely free.
Absolutely free. Yeah, there's no cost to it. We're actually going to have it over in what we call the LDC building, the Lubbock Diagnostic Clinic. It's the building just to the east of the main campus, Covenant Medical Center. Just to the east of that, the parking is also on the east of that building. It's real easy to get into.
Okay, when you say just east, is that like the professional building there with like all the physicians in it?
Yeah.
Okay,
Yeah,
is
it's
it gonna
like
be-
5 stories tall.
Yeah, yeah. Okay.
It's like in the parking lot of.
It's right next
Right
to
next
what
to
was the valet, but
Yeah,
we have
yeah.
construction,
Right.
so I'm not sure what's there.
Okay,
now.
so when
Oh,
people
really?
walk in, is it going to be like on the first floor? I mean, it's going to be easy to find.
Right on the first floor, there's a lab down there. They let us use the lab. We're going to have some phlebotomists there to take your blood. And so men need to man up and not be afraid of the needle. It's not going to hurt. It's a little bitty blood draw. No big deal. You'll probably be in and out very quickly.
Is this a while you wait thing?
Is this a what?
While you wait thing? I mean, are you going to?
How quickly can
Yeah,
men
well, are you going to get the results while you're there, or are they going to
No,
call you?
the results take probably anywhere from a couple of days to maybe a week.
Okay.
Just depending. I'm not sure where they do, where they read the labs and all that. But we will definitely let you know what the results are, and highly encourage you to get in touch with a physician to talk about that.
When you do this, how many people do you anticipate are going to be participating in this?
Oh, I would.
Any idea?
I would love. No idea. I would love to see about 100 men. That would be wonderful if we could get 100 men in there. But I'm not really sure. We're not doing a RSVP line. People don't do too much of that anymore. They don't call in and say, "Hey, I'm coming." Mm-hmm. So we're just going to put the word out and say, "Come on out." On your way to, if you're going to drop your son off to baseball practice or whatever, come on out. It won't take long. It might take 10 minutes, maybe 15. And then you're in and out. So we got plenty of time from 8 to 12. There's no reason not to drop in.
And a simple little blood test could lead to possibly saving your life.
Absolutely could. If they find an abnormal or very high PSA, it would be something that you definitely need to follow up with. Absolutely.
All right.
We actually, when Laura had her breast cancer discovered, we were talking about all that stuff, about being BRCA positive. Mm-hmm. And we actually had a listener's wife go in and get tested because of the conversation we had, and found that she had breast cancer.
That's what we're hoping for. Cancer is not what it used to be. Cancer was like, oh, that's a death sentence. It's not.
You need to know.
You need to know. And the early screening and creates early prevention, and that's the road to take.
Right.
That's absolutely the road to take. You don't want to come see me over at the cancer center.
No.
All right, Joe.
But we're glad you're there if we need it. So
Right,
there you
exactly.
go.
Yeah, Joe, thanks for coming in, man.
Thank you so
appreciate
much
that.
for having me.
Give
Yeah.
us the details one more time. Where, when, how?
We're going to do it August 29th. It's this coming Saturday from 8 a.m. until 12. We're going to do it at the LDC building. I think the address is...
That's Lubbock Diagnostic Center.
3506 21st Street, right next to the big campus. So if you want any information, you can call me at 725-8002. I'll be glad to talk to you and give you more information. The building outside, they'll have a big 14 on it if you want to use that instead. We have numbered our building, so it'll be building 14 just east of the big Covenant Medical Center building. We'll have food. We'll have some educational materials to hand out, and just a little blood test, and we're done. You
All
can
right.
come and go.
Thanks, Joe.
Thank
We'll see you
you.
on Saturday morning, 8 to 12.